Hi, my name is Colleen Wong and I'm the founder of Tech64. I'm here today to raise funding to bring a revolutionary service to the aging and dementia market. My team and I are on a mission to improve the lives of 100 million older people by 2030. So I started my business, Tech64, 5 years ago when I was a new mother of two. I took my kids to a farm and saw a mum running around looking for her child. It was then and there I had a light bulb moment. A wearable mobile phone and tracker for children with no access to the internet, social media, or games called My Gator Watch. So this is what the black one looks like. Without any technical experience or education, I developed something simple, affordable, but extremely useful for parents. To my surprise, many of my customers were buying My Gator Watch for their own elderly parents. We hadn't actively marketed to the aging market, but we had already over 500 users over the age of 65. 4 London councils currently buy our watch for the elderly in their care. I participated in a healthy aging challenge with AXA Insurance in 2018 and won, beating out much bigger players. I've done extensive research into the customers who bought my watch, and they said they loved it because it was affordable and simple. Now here's the big problem. The global aging population is growing faster than all other age groups. In the UK and EU, the aging population is set to double in less than 30 years. What I've learned from my customers is that connection and communication are extremely important, but also that there is nothing more important to older people than health, independence, and well-being. But 40% experience threats to these 3 key things and often don't report them because they don't want to burden their family, carers, or even the police. Now, during the first UK lockdown, which is roughly March 2020, I met a consultant to the World Health Organization who is an expert in global aging. He developed a proprietary assessment tool for healthy aging, which has proven to increase healthy life by at least 1 full year, but also decrease public health costs by an astonishing £33,000 per person. There's no other similar product or service that exists which has this great an impact on both the economy and to the older person. In May of this year, my partner won the prestigious Healthy Aging Prize at the UN-sponsored World Summit for the potential impact it has on healthy aging globally. We are both on a similar mission to make the lives of older people better, especially focusing on the independence, health, and well-being. And so we decided we would become partners. Our solution to the problem mentioned is called Golden Gator, a healthy aging platform which collects and connects key data within the Golden Triangle, which is the older person, family and carer, and services for the older person. And we do this in order to generate outcomes resulting in the highest quality of life for the older person. Our platform connects to a wearable device which is worn by the older person. The wearable is used to connect to family carers and emergency services, but it is also used by our trained assessors to proactively reach out to the older user monthly to determine if they have any concerns that need to be addressed. Once the concerns are known, our platform suggests local services which they can connect to, which will help them sort out the concerns that they have. While age tech largely focuses today on what can be used by an older person in case there is an emergency, we combine this with a proactive feature that combats loneliness and to ascertain concerns before they become worse. Now, our plans are to start in the UK, where we currently have an existing customer base. The 4 councils who currently buy My Gator Watch love the new wearable platform for older people and want to bring it on board when it is ready. We will also target large organizations such as charities, insurance companies, hospitals, and government bodies to distribute our watches to the aging market they serve. My partner has a wide network of businesses in the aging space, and this will be our initial route to market. We plan to distribute our smartwatch free with our model of a recurring monthly service plan of £15 per month, which includes all services. So this includes voice, data, and the monthly assessments. Our current MyGator Watch users pay £10 per month, and they use it for a minimum of 2 years. So we know that there is a willingness to pay from this market. We don't have any direct competitors, as our service is one of a kind. However, other wearables such as tracking and health monitoring devices will attract a percentage of our target market. Our total addressable market is 4.8 million people over the age of 65, which is 40% of the total over 65s in the UK, which is 12 million. Our management team includes myself, who will be the CEO. I hold an MBA from INSEAD and have built MyGator Watch over the last 5 years. My CTO, Gareth, has over 25 years experience in product design, software, system, hardware, platform architecture, device and platform security, embedded and mobile platforms, and firmware design and development. He has worked for Intel, TomTom, and Motorola. And the partner who I mentioned before, who's an expert in global aging, is Dr. Ian Philp. He is currently, as I mentioned, the consultant to the World Health Organization. And his assessment tools for the aging market have been developed and trademarked by Ian and are the only tools recognized by the World Health Organization. He trained as a doctor within the NHS for 7 years and became the National Clinical Director for Older People in England. He was awarded a CBE by the Queen in 2009 in recognition of his work with older people and healthcare. As a team, we bring together aging expertise, years of market research and analysis, technology development experience, bringing a new product to market, and an understanding of the end user from both product and service side. We are looking for an investment here today to build our solution to one of the world's most challenging problems and one of the UN Sustainable Development Goals of health and well-being. Thank you.